The great thing about 988 and why a lot of people call it is you don't even have to give them any of your information. You can actually call and you can just talk to someone and get connected to resources without sharing anything about you. So you can remain anonymous and get those resources. If you're afraid of somebody finding out or not wanting to know, you can reach out, but you also can share your information too, and that helps them to get you better connected to resources.
Welcome to For the Health of It, Because You Can, where host Susan Robinson dives into the 8 categories of wellness with experts from various fields. We offer tips and information to help you thrive in all areas of individual wellness.
As many of you know, Thrive follows 8 areas of well-being, which is it follows the SAMHSA, which is the Substance Abuse Mental Health Services national level. And the 8 categories that we cover are physical, environmental, social, financial, occupational, intellectual, spiritual, and then lastly, I'm going to talk about emotional health. And that's where we're going to be talking with Tony Stelter from Department of Mental Health Services and Substance Abuse Services for the state. And we're going to be talking about 988. As many of you know, that started a year or so ago, and then other services that Department of Mental Health offers to help as well. So, Tony, what is 988, and what was the purpose of creating it?
Yeah, so 988 is a 3-digit mental health lifeline that anyone can call anywhere at any time. It's 24/7. It actually started, some of you may have known about this, you may not, but we used to have, it was called the National Suicide Prevention Lifeline, and that has existed for years and years and years. What that number was 1-800-273-TALK. As many of you know, though, whenever you're in a crisis or in a situation where you're feeling very, very stressed, our brain kind of doesn't function as well as you would think it should. And so there were a lot of advocates that were, that said, man, maybe we can make this a little easier. And many of us know 911. That's a real easy number to remember. So how can we make this a 3-digit number? And so they did a lot of, listening sessions and groups and research, and they decided to go with 988. And so 2 years ago, it was in July of 2022, is when 988 launched. You can still actually call, just so you know, you can call 1-800-273-TALK, and it'll still work. It takes you through the 988 line, but it's a national lifeline for we call it. Nationally, it's called the 988 Suicide and Crisis Lifeline. In Oklahoma, though, we call it the 988 Mental Health Lifeline because we want to make sure that folks can call it to before it's they're feeling maybe thoughts of suicide or a crisis. If they're just needing resources or need someone to talk to figure out where they can go to get that help before it's a crisis too. And so that's a little bit of history and what it is, and hope that answers the question.
It does, and I was wondering about that because if people think that's just a suicide hotline or whatever, but the fact that if you're just you're getting to before that point when you're in decision making and you're struggling and stuff, I think that's a great idea to present it that way, that, hey, do this before you get to that point.
Yeah, and a really cool statistic is whenever folks when it launched, the 988 Lifeline launched in July 2022, for quite some time, the main reason people were calling still was due to, having thoughts of suicide or even plans of suicide. And it actually, as time has gone on, that's still the number 2 reason. But number 1 reason is for coordination of care. So it's for folks reaching out, needing resources or looking for resources for a loved one or friend or family or for themselves. So to me, that's kind of a pretty cool statistic, knowing that folks are reaching out to get care even before it's a crisis.
Yeah. So do you happen to have any success stories from the 988 line?
Yeah. So just so you know, before this role, I'm in the Chief of Statewide Crisis Services role now, and it's been about 7 months. So before that, I actually worked at Solari, which was the state's contact center. So each state has the ability to kind of do, whenever they open this up in 2022, states were given the opportunity to kind of take some funding through the SAMHSA. And they also, Oklahoma used state funding as well to kind of to integrate these services and contract with an entity to provide that contact center service. And so Oklahoma contracted with a company called Solari as their primary contact center. And then they also have 2 backup centers. So if say that are in Oklahoma, they could have done this in other ways. You could contract with a center that's in another state even, and so they're taking those phone calls. There's lots of options you could do, but Oklahoma wanted to contract with a company that was going to have Oklahomans answering those calls. So Solari is actually an Arizona company. It started out, but they actually hired Oklahomans and expanded to Oklahoma to do this. So they had a lot of experience in Arizona. It's one of the leaders as far as crisis services looked at. They do a lot of work with other states too on what they've done to help them fit to what works in their state, which we had to do too, because Oklahoma is definitely not Arizona. But it is, but we can take some things they've learned and use some of those things, and then also tweak them to work for us. But I'm going off on a whole side road here. But I worked for the company Solari, which was that primary contact center, and some success stories that from the time that I was there. One of them, when I remember, was we had and this was actually when we launched text. So text launched about a year after the 988 line, as far as in Oklahoma, where Oklahomans are answering those texts. Those texts were still being answered, but not necessarily by Oklahomans. We had a kiddo actually through the chat line that had reached out, and he was at school, and he had actually had a suicide attempt the day before, a failed attempt, and then he was still having those suicidal ideations. He was willing to give information about where he was, what school he was at, and it was willing for us to get him some help. So we were able to contact his teacher, or not teacher, the school system, while we were chatting with him, and then they were able to wrap services and support around and prevent that from happening again, because he was in a really high-risk situation. And so that was a success story. We've had other success stories where I mean, there's just so many where folks have called. They had a plan, and then after talking, they were able to give their firearm to a friend, and then agree to a mobile crisis team coming out and speaking to them, and then get into services. We have folks that needed to go somewhere that night, and so they were able to get into one of our urgent recovery clinics or crisis units as well. And those are just to name a few. There's many, many more.
I can imagine. I can remember when I first started with the state, I did health coaching, and I remember this employee talking to me about her daughter, because her daughter's friend had committed suicide, and they're in a rural area. And she was like, my daughter's real depressed, and I guess sometimes that kind of causes a group to start doing the same thing. And the only thing I knew to do was to give her the Department of Mental Health's website and contact numbers to at least call and do something. So to me, this is you're right, it is a lifeline, because I could have easily said, call 988 right now, because she was worried about her daughter. And I'm so glad that this has been developed, and I think it's going to be great. So you said at first that when it first started in 2022 that it was mostly about suicide attempts. Do you feel like that there was a rise in that since the pandemic? Has the pandemic had that kind of effect on people?
Yeah, I actually brought some statistics for you. So from 2017, and these are the numbers through the Department of Mental Health, and they get these numbers through the medical examiner's office. They may differ slightly from the Department of Health numbers. They get a little bit more information. So sometimes a death may be determined suicide at a later point because of some of the information they get. So I just want to put that out there. So what we have for 2018, there was actually a 13% decrease from 2017. It went from 825 deaths by suicide. to 718, which was great, right? To have that, not great to have any. We were always going for zero, but to have a decrease is good to see. 2019, there was an increase. It went up to 753. 2020, there was a 13% increase for 2020, went up to 851. 2021 also had an increase. It had 4 more to 855, so just a 0.5% increase. And then 2021, it went up again. I just said that, 2021. 2022, it went up again to a 2.3% increase to 875. 2023, we had an increase again, but only 0.9, so under 1%, which is it's not a great statistic, but it's still
good.
That didn't go up as much as it did the year before. And actually, so far, these numbers could change because sometimes information comes in after the fact. But for fiscal year, this is all fiscal year, by the way. So it would be so for fiscal year 24, actually we had a 6.1% decrease. I hope that stays that way. I hope when more information comes in, it doesn't go up. But so far, for the numbers we have, we went down for fiscal year 2024, which is June 30th or July 1st through the end of June of this past year. So we just ended fiscal year 2024 this past and started fiscal year 25 July 1st of this year. So that's a great statistic to see. But it did, as you could tell, it did go up during those years you were just speaking to, the pandemic, and it makes sense considering the isolation and all the things. There's a lot of factors that could have gone into that, but I know there's a lot of research still being done. Yeah.
What I'm finding as far as being in wellness is, of course, most of them have gone home, like one agency totally are at home now. And I think that it's been a tough transition as far as the landscape and wellness, but I still don't see people being back to what they were pre-pandemic. I think people still struggle. They like working from home, being able to roll out of bed and not have to put on dress clothes and drive to work, but they're lonely. And so I'm actually going to attend a conference in the spring that's about that. The World Health Organization has some statistics on that. And so anyway, but it is what it is. And I think it just, had a lasting effect because we just have not climbed out of it yet, I don't think.
Yeah.
And so
I don't disagree with you. I think there's all kinds of variables and things going on in the world that are stressors. One great statistic, though, I would say, or one great thing is I think people are getting more and more comfortable talking about mental health, and which to me is is super helpful. I think with each generation, people get more and more comfortable talking about it, and I think that's going to make a major difference.
Do you think the people like athletes like Simone Biles and other great athletes have finally come forward and talked about their mental health struggles? Do you think that that's kind of helped people to go, okay, well, maybe it is okay for me to talk about it?
I do. I think it helps bust the stigma, when it comes to mental health, which I don't want to mess up one of your questions here, but that is one of the major reasons why people do not access services. I believe, and when you look at a lot of research too, like people don't feel comfortable necessarily talking about it or reaching out because of they're worried about what others may think or the stigma that's associated with it. So anytime somebody of that status willing to be vulnerable, vulnerability is one of the biggest things as far as busting stigma and being willing to speak about it in an honest, genuine, authentic way, like she does, and then so many other athletes and those in those positions using that platform and pedestal to do that, I think is amazing, and it's much appreciated. It helps people probably more than they'll ever know.
More than they'll ever know. Yeah. You're right. I agree. So I know that the 988 is still out there, but I believe we had talked about there's some other sources that Department of Mental Health offers.
Yeah. Oh man, I can't. There's so many resources that the Department of Mental Health offers that I can't even speak to all of them. But you can go to our website, and there's you can find a lot on there. But as far as crisis services, which is what I can speak to the most, because that's my lane. And if you're state employee, we also offer EAP services. You can get to that through our website too, or you can just Google, EAP Oklahoma, and you'll probably find it there too, or ODMHSAS EAP, and you can find our website. But as far as crisis services go, I always like to spread the word on this. Is we have what we call urgent recovery clinics. They are a kind of, I like to think of them as a mental health ER, where folks can come in. You can walk in. We have folks that are sometimes brought in by law enforcement. We have folks that can be brought by a family member. But basically what their job is to try to keep you in the community and try to get you to the lowest level resource that's appropriate for you. But they're going to do an assessment, and they're going to get you connected to that most appropriate level of care. You're going to see a licensed mental health professional. There's case management. There's peer support involved, so folks with lived experience that have been through it themselves. And sometimes you might need a higher level of care, which they're able to get you to, which I'll talk about in a second. But a lot of times they're going to get you to a lower level of care, which is our stats show it's between 60 and 70% of the time folks are not needing to go to a higher level of care when they come to that. Yeah, that's good. And that might be a community mental health center, or CCBHC, which is what we call it, which stands for Certified Community Behavioral Health Clinic, or it could be a private provider if that's what you would like. It can be a mutual support group such as like AA, or depression and bipolar support groups, Support Alliance, or NAMI. There's things like that. There's lots of different resources, but their job. Sometimes you might need a resource such as food or housing and things like that. And they can help get you connected to those resources as well. So if somebody does need a higher level of care, this is the other part of it, which is we have crisis stabilization units. We have sometimes where they're connected, and we call those crisis centers. Or, for the long way of saying it's community-based structured crisis center, but I just like saying crisis center because that's a mouthful. But that crisis unit that can be attached, and they can be separate, that's if somebody needs a higher level of care. So they're meeting that emergency detention status, which means that they're, imminent threat to themselves or others, or they may have a psychosis or something going on, symptoms of psychosis going on that makes them vulnerable or possibly a danger to others due to that, or vulnerable of being preyed upon by somebody else because of that. They can get a little bit longer care. So at a crisis stabilization unit, which can include medications, peer support, case management, therapy, things like that, support groups too. And then those are actually able to, folks, when they go to that level of care, like around 90% of the time, they're not needing to go to a hospital, inpatient hospital level of care. And it's shorter term, which is what we want. Keep folks in the community with their families, loved ones, friends, with those resources in the community. And then if they need longer care, we have inpatient available too. But then we also, another cool part of the system that we offer too is if you needed to go to a hospital, or if you say you were evaluated and you needed to go to like a URC because of what was going on in the community, or to from a URC to a crisis unit, or from a crisis unit to an inpatient bed. That was done by a law enforcement officer, which we talked about stigma. And how that sometimes can be a thing, and detrimental, and sometimes folks have trauma related to that too. We actually, through legislation, there was a bill that provided, made it so that we could have alternative transportation, so that law enforcement isn't doing that. And the Department of Mental Health, in partnership, there's also Medicaid compensation that can happen now with that too. But folks going from that point A to point B, as I described, if they're meeting that status, can now be taken by an alternative transportation provider that's not a police car, getting them from point A to point B, which is a big game changer.
Big change.
It also helps law enforcement. Because we have some law enforcement entities that were doing those that, are real small municipalities in the state that may just have a few officers, and then that's a big burden and a cost that they were getting reimbursed for that. But that's a big, pulling those officers out, that are providing safety to their community to do that transport was a burden on the law enforcement entity. So they're very happy about it too.
Right. Well, let's kind of end it with, what would you say to someone needing help to encourage them to seek it?
Well, the great thing about 988 and why a lot of people call it is you don't even have to give them any of your information. You can actually call and you can just talk to someone and get connected to resources without sharing anything about you. And so you can remain anonymous and get those resources. If you're afraid of somebody finding out or not wanting to know, you can reach out. But you also can share your information too, and that helps them to get you better connected to resources. And if you need to call again, they'll know what maybe has helped you in the past, so they can help you better. But I would say just reach out. Like somebody wants to help you. They love helping. You're worthy. You're worth it. There's things out there that will work for you. So please do it.
And it's non-judgmental.
It's non-judgmental. These folks really care. A lot of them have been there too. So, yeah, please reach out.
All right. Thank you, Tony. I appreciate your time that you've given here, and hopefully the listeners will spread this information to friends and family, and a lot more will know about this. So I appreciate you being here.
Thank you for listening to For the Health of It. For more wellness tips, information, and videos, visit the Thrive webpage. For questions, contact us at thrive@omes.ok.gov.